Accountable care and value-based care are healthcare terms you probably hear a lot about these days. But what do they really mean when it comes to your health? Steve Stedman of Humana, he is here to talk about the importance of Medicare beneficiaries finding the right care. So good to see you.
Hey, great to be
We're kind
here.
of playing with those terms, but I mean, they're terms that you're trying to muddle through right now. What do they mean to our viewers?
Right. Well, so if you look at the traditional way healthcare is delivered, someone might go in to see their primary care doctor and they're going to get services. The doctor's going to get paid depending on what's going on. It could be a well visit care. It might be maybe something more serious. But what we're really looking at with value-based care is really trying to move back down the continuum and saying, is there something maybe more we could do in the preventive area that maybe head something off from happening down here?
And I'm sure that means a lot to patients, addressing it before it becomes an emergency room visit, correct?
Absolutely, absolutely.
So how does this benefit patients? How do patients benefit from their physicians being a part of this health care?
Well, I think at the key is really the idea that we really want to have the patients have more time with their doctor. So they're not just being in there for just a very short time, but actually maybe having as much time as they might need. And really the team approach is really a big part of this. So you might just not only have the primary care physician, you could have somebody that like a health coach. We could have somebody that maybe would deal with behavioral issues. Again, as we talked earlier, I might have, maybe I lost a spouse, maybe I lost a pet, or I'm worried about money. So I might not really need to see the doctor, but I need to talk to somebody because, as we know, things like stress and things, they can actually cause health problems later on.
Absolutely. So a counselor would come in.
Exactly. So somebody would be part of that team could help, again, head that off, even though it's being done a little bit different. But again, it's under that umbrella of just really the value-based care.
And I know you guys are partnering with providers to really benefit Medicare-eligible patients. How are you doing that?
Well, I think, again, you've kind of got these three components working together. You've got the patient, certainly you've got the provider, you've got the health plan. And really it's our job to continue to train and educate the provider and also bring technology into the picture. Again, we kind of talked about this just a little bit, but something as simple as maybe a FaceTime or a Skype, if your provider happens to do that. Let's say mom and dad have retired to Arizona, but the kids are back east, but something's going on, and the kids would like to know what's happening. Maybe they would like to be part of that conversation. Well, how cool it is if your team, where you go for your services, they could just FaceTime or Skype those kids right in.
That idea. And I told you that is
Yeah.
so vital because a lot of times when you're getting this critical information, maybe a very serious diagnosis, you don't hear
understand
what's going on.
all that talk.
Right.
Part
And you
of
try to, you're not taking notes, you're not
Yep.
doing what you need to do. So
Exactly.
having that third party is so critical
Very,
and
very
so
important.
vital. So what are some of the positive outcomes that Humana is really seeing and have you seen with your Medicare patients?
Yeah, that's great. And again, I think coming again out of the value-based care model, one of the things, I just read an article last week that spoke volumes to me. We did a study across our patients, members who were in value-based care, over thousands and thousands of patients. We had a 6% reduction in emergency room visits.
Wow.
Again, 6% doesn't sound like a big number, but over a vast population, it's huge. And I think, honestly, if you said to most people, hey, would you like to go hang out at the ER today? They're probably going to say not so much, right?
Right.
Well, they don't. That's not how I'm planning to spend my day.
Right.
So any type of reduction like that it's better. Everybody actually wins, which, again, is what it's all about.
And again, preventing those ER visits,
Yes.
it's so critical. So how can Medicare beneficiaries really take a part of this transitional approach that you're taking?
So we're all consumers. And
Yeah.
when I was thinking about this question last week, I thought, well, this is interesting. So think about maybe the last time you might have bought a car and maybe you went out and test drove 2 or 3 cars, or maybe you looked at 5 or 6 houses before you picked. Oftentimes when we're doing an enrollment with a Medicare beneficiary, and maybe they need a new PCP, primary care provider, they might just look in the directory and go, well, this person's kind of close. I think it's really time now where people need to start doing some interviewing. This is my health care. I want to know if something happens, who's going to be around me to help, right?
I like that.
Who's going to surround me? So I think as a consumer, what you do is you go visit some offices and you do some interviews and you meet the doctor and you find about how they practice in their office and their team.
What a different approach.
I think and that's really the transformational healthcare model. That's really where you start transforming healthcare into healthcare.
I
right?
like that. Go do some interviews. Good for you. Coming in and say, I don't have an appointment today. I'm here for an interview.
But yeah, I'm going to interview you for a change. Right? Let's do that way.
I love that. When does open enrollment end? Very quickly.
12/7, December 7th, it's over. Remember that date. It's very important.
It is important, and we want to give you some important information now. If you, for more information, finding the right care for you and your family, contact Humana, 1-800-552-0771, or you can visit their website, humana.com/Medicare.